midterm side question. Side question number 1. In patient who undergone post-op transfemoral aka secondary to MVA, given the precautions in treating patient, what specific precautionary measure should you consider in ROM exercise and functional activities? In ROM, we should be precautious about the incision site, and for the functional activities is the weight bearing of the patient. And side question number 2, in early rehabilitation phase and short transfemoral amputation, what should be the main priority of the therapist? Functional independence of the bed, mobility and transfer, or regaining ROM? Explain your statement. Regaining ROM, because the patient in early rehabilitation phase should regain the range of motion of both affected and non-affected side of the leg or limb, lower extremity. Side question number 3. In patient with comminuted fracture on the distal tibia, you are about to progress in patient into more specific intervention. What should you be assessed prior to any heavy activity interventions? So we should assess the patient's weight bearing status. And side question number 4. In patient who undergone TAR in traditional approach and with mobile bearing, discuss the potential advantage and disadvantage of the patient's recovery. Explain and elaborate. So the advantage would be the patient should feel a relief after the pain and all after the traditional approach, and on the disadvantage would be the patient would maintain the exercises and treatment for the traditional approach on his or her knee. And side question number 5, in transition to the patient care and to moderate protection outpatient care for patient with TAA, what activity should the patient perform without worrying in the precautionary and preparation of the patient's community ambulation? So we should be doing on the patient is ROM exercises with from sit to stand if the patient is able to weight bear during the moderate protection phase. So that's all.